The Toxic Lady, the true story of Gloria Ramirez. In February of 1994, something happened inside a hospital in Southern California that even today remains unexplained. This is the Dark Sermon, Stories from the Shadows. It began as an ordinary emergency call. At around 8:15 p.m. on the night of February 19th, paramedics rushed a 31-year-old woman named Gloria Ramirez into the emergency room at Riverside General Hospital, just east of Los Angeles. She was suffering from advanced cervical cancer, and when she arrived, she was in severe distress, her heart racing, her blood pressure crashing, and she could barely breathe. Doctors and nurses immediately began working to save her life, administering sedatives, oxygen, and electric shocks to stabilize her heartbeat. But as the team surrounded her one by one, they began to notice something strange. Nurse Susan Kane later described a faint, fruity odor coming from Gloria's body, something that reminded her of garlic and ammonia. Another nurse said her skin looked oily, almost as if it was covered with a thin layer of grease. When a respiratory therapist drew her blood, the entire room caught a metallic chemical smell. The nurse holding the vial noticed small, manila-colored particles floating inside the sample, something no one had ever seen before. Then people started collapsing. One nurse suddenly slumped to the floor, unconscious. Another began to shake and vomit uncontrollably. A doctor treating Gloria staggered out of the trauma bay and fainted in the hallway. Within minutes, the emergency room had become a scene of panic and confusion. Staff were coughing, dizzy, nauseous, some reporting burning sensations in their throats and faces. The hospital's emergency coordinator ordered an immediate evacuation. Doctors continued to work on Gloria as best they could, wearing protective masks and gloves. But despite their efforts, Gloria Ramirez was pronounced dead at 8:50 p.m., just 35 minutes after arriving. Her cause of death? Heart failure brought on by kidney failure due to cancer. But that was just the beginning. 23 people in the hospital had now fallen ill. 5 required hospitalization. The most serious case was Dr. Julie Gorkinski, a resident who spent 2 weeks in the intensive care unit, suffering from respiratory failure and hepatitis-like symptoms. The incident was declared a hazardous materials event, the first time in history a hospital emergency room was shut down because of a patient's body. Hazmat teams arrived in full suits, taking air samples and searching for leaks of any kind, cleaning agents, chemical spills, toxic gas. They found nothing. When the coroner's office received Gloria's body for autopsy, they too began to feel sick. The examiners noticed an oily sheen on her skin and a strong chemical odor coming from her remains. Her body had to be stored in a sealed, airtight aluminum coffin for several days before the autopsy could continue. At this point, the media had already named her the Toxic Lady. For weeks, officials had no answers. The Riverside County Department of Health launched an extensive investigation. They interviewed hospital staff, collected air and blood samples, and even tested the hospital's air conditioning system. No trace of a biological or chemical toxin was found. So what happened? Months later, a team from the Lawrence Livermore National Laboratory proposed a theory, one that is still the most widely accepted explanation, even though it remains controversial. According to their findings, Gloria Ramirez may have been using a pain relief substance called dimethyl sulfoxide, or DMSO, as a home remedy. DMSO was a common over-the-counter solvent in the 1960s, but it was later banned for human use after being linked to eye and liver problems. Some people continued using it as an alternative treatment for pain and inflammation. The scientists proposed that when Gloria was given oxygen in the emergency room, the DMSO in her system could have oxidized into dimethylsulfone, a crystalline compound. The crystals in her blood sample, those yellowish particles, might have been this compound. Under certain conditions, dimethyl sulfone can further react to form dimethyl sulfate, a highly toxic chemical that vaporizes at room temperature and can cause nausea, convulsions, and paralysis. Exactly the symptoms reported by hospital staff. If true, Gloria's body itself might have produced a small but deadly cloud of poison gas. But the theory had problems. Many chemists argued that the chemical reaction described was highly improbable at human body temperatures. No definitive proof of dimethyl sulfate was ever found in samples taken from the hospital or Gloria's body. Still, no other explanation has ever made more sense. After months of testing, the official report concluded that there was no evidence of foul play, no contamination in the hospital, and no infectious disease. The deaths and illnesses were classified as an isolated chemical incident, but one without a proven cause. Gloria Ramirez was buried 2 months later in her hometown of Riverside. Her family has always rejected the DMSO theory, believing she was treated carelessly and unfairly blamed for something she couldn't control. To this day, more than 30 years later, no one knows for certain what happened inside that emergency room, only that something invisible filled the air that night and turned a place meant for healing into a place of terror. Gloria Ramirez became known as the Toxic Lady, not because of what she did, but because her death exposed something about how fragile our understanding of the human body really is. Sometimes even science cannot explain what it encounters, and that is the story of the Toxic Lady. If this story unsettled you, there are more sermons waiting in the dark. Subscribe and step back into the shadows with us.